So welcome to the next in our lifelong care strategy podcast series. My name's Charlotte Routh and I'm one of the Trust clinical strategy leads. We're here today to talk about the Northumbria Patient Charter, and I've got two guests joining me today, Jo Mackintosh, who's our Chief Experience Officer, and Judith Farquharson, who's one of our Trust lay representatives. So the heart of our lifelong strategy is that people are at the centre of it and our patients are cared for by local people in the right place with their wishes and their wants at the centre of this. So we want to put them at the heart of what we do and the heart of what we think about in our teams as we support their care. So we've done a lot of listening to what patients, carers and other people said, and Jo's team has been part of that and crucial to that. We've also done engagement into the community, to our patients, to carers, also to the voluntary sector, and we reach out to other people outside of the healthcare system as well. But today we're here to talk about our patients and our promise to them and what the Charter says, and it's due to be launched shortly, and this is sort of a podcast leading into that. So Judith, I wanted just to come to you first, so welcome, and you're one of our lay representatives. Just can you tell us a little bit about that role, how you got into it, what it involves?
Yes, well, I've been involved since the beginning. It came about because I saw, I think it was a newsletter from Healthwatch, and it was advertising this new role. I thought that sounded really interesting, and it came at a point when I just semi-retired. My background is very much based in the community, spent 25 years with Citizens Advice Bureau, and then established a charity. So I thought I probably had the skills to be able to transfer into the role. So I applied for it, was interviewed by Jo and her team, and fortunately was successful.
Okay, great. And what does your role involve? What do you do as part of your role?
Well, it's very varied, and you can be involved as much or as little as you want to. But the group itself meets once a month, and we usually have a guest speaker who comes along and talks to us from one of the different areas within the Trust. And then we can be involved in different committees, focus groups. For instance, on the Macmillan Cancer Information and Support Steering Group, I was involved with the pilot for the Health Navigator and on the interview panel. It's very varied, very interesting, extremely rewarding because you make a tangible difference by working alongside, health professionals. And I suppose as a lay representative, what you're doing is bridging that gap and championing the patient, making sure their voice is heard.
So the group we're talking about is the Northumbria Participation Group, is that right? So Jo, you were involved in forming that group. How did it evolve? How many people have you got on it?
So our ultimate aim was to have 12 lay representatives in the group. That was our starting point. But I think the work that we did in the early days in terms of the preparation. So there is a lot of work to set up a group such as our Northumbria Participation Group. So we looked at all the governance issues, etc. So to be able to do that role effectively, our lay reps need access to trust papers. So they are an equal member of a committee, etc. So all of our lay reps have trust email accounts. They're part of the organisation, but as Judith has beautifully described, bridging that gap between our patients and communities with the trust and our health professionals. So when we went out to advert, the lay rep role for me is a very specific role. So it's not bringing an individual experience, but it's bringing the perspective of a community, of a population in terms of bringing that voice into the room. So through our interview process, there was actually 7 people that were really clear about what that role would involve and that actually they felt really engaged with delivering on the objectives of the lay rep. And that was how we started. So we started off really slowly. We developed our own terms of reference. So we actually co-produced a lot of the governance for the group itself. And we've continued in that vein, haven't we, Judith?
Yeah.
Developing our own action plan, our communications plan and role descriptors, all of these different things that we've collectively developed together. And we've just recently had our first annual event where we wrote a report about all of the work that the group have done over the last 12 to 15 months. And we had a fabulous evening. Bijou opened it for us. and the lay representatives presented their work, but also we had staff from across the trust, because I think it's important that we don't see the group just as the only involvement activity. There's lots of other involvement activity happening across the organisation, and some of our staff are doing amazing work working in partnership with communities. So they came along to talk about that, and it was a really good evening, wasn't it, Judith?
Absolutely was.
And essentially we just celebrated good involvement practice in Northumbria healthcare. So I think our vision is to continue to build on that and to get to the point, I like to say, where we are with experiential measurement in Northumbria, that it's just in our DNA and it's what we do here.
Yeah, great. And I know that since the formation of the group, you've been working really hard on the Patient Charter, and that's been a big part of the work that you've done so far. So can you tell us a bit, what is the Patient and Charter and why was it written?
So essentially, it was a piece of work that was started by the Realistic Medicine group. So Jeremy, Lindsay, Simon, all and the rest of the group members have really been looking at how can we develop a charter for patients that is very much about what patients can expect from the conversations we have with them and how we support them through the process of care. So when the group was formed, Lindsay and Jeremy and Simon spoke to us about, we'd really like to get some traction with this piece of work, and came to talk to us, didn't they, Judith?
Yeah.
It was probably in the early months, wasn't it, when we very first
yes,
started. And they came to talk to us about what their thoughts and ideas and visions were, and we sort of picked it up and just ran with it start, didn't we?
Yeah.
So Lindsay, so our first stage was to bring the lay reps together. So Lindsay facilitated a session with us, and it was in North Tyneside Hospital, and it wasn't it? And we spent a full afternoon just starting out with the bones of it, I would describe it, wouldn't it?
Yeah.
And we sort of came up with this before, during and after treatment, and what would that look like in terms of a charter. And I don't know about you, Judith, but I thought that really helped us to structure the charter and think about what it was.
Yeah. It was the very start of it. And it's great how everybody works together as well. The lay reps with the health professionals, bringing all the ideas together, and having that patient perspective really helps with the language and everything.
Yeah.
And obviously you probably had some feedback from patients prior to that you were able to feed in as well. Is that specific questions you've gone out and asked patients towards the charter, or was it stuff that you'd found as themes in previous sort of patient experience?
I would say, Charlotte, very much through the themes that we see in patient experience measurement, because we, as you know, we do so much patient experience measurement, and that we really understand the things that matter to patients. And what was great is those conversations we had that afternoon absolutely aligned with the things that we see in our data and through our patient comments. And that was just the beginning, and it was a bit of a copy of War and Peace to start with, wasn't it?
It was,
so
yeah.
It sort of went like this. And the task was to hone it down and to make it into something that was more manageable and accessible.
And easy to understand.
Yeah, absolutely. And I think there was times when it wasn't. Even to us who feel immersed in it. But we started off on a whole sort of roadshow of engagement. So every opportunity, so we thought, as well as our lay representatives and obviously looking at our patient experience data and what patients were telling us already, and our engagement with our communities, it was really important to engage with our staff as well. So we went off to a lot of forums. So we went to Clinical Policy Group, and we got some amazing feedback on one of the Friday afternoons that Lindsay and I went to CPG. We went to the Nursing and Midwifery and Allied Health Professional Board. So we went to externally as well. So we visited the Age and Well group. We also went to both of the carer partnership boards. So we just tried to, and what we kept doing was I kept bringing it back to the lay reps. We'd look at it, we'd pull it apart, wouldn't we? We'd then bring it back together, and we're on about version 12 at one stage.
Must be.
Yes. So I think you're on the final version though. Is that right? Yes, Lord. So tell us what it looks like. I've seen it, but obviously people listening to this haven't seen it. We will hopefully add it in at the end of this podcast for people to see. So what's the structure of it now? What does it look like?
So essentially it consists of 10 principles, we say, and those principles, people will probably recognise hopefully when they have a look at it and take some time to read it, is they will see that sort of, I'd say the ethos of the before, the during and after is still clearly there.
It is, yes. And it's a commitment, isn't it?
Yeah. And So it consists of 10 principles that look at sort of that before period of time for our patients and their families and carers. And it's things around preparing for an appointment, where the appointment is, the information that we provide for our patients. Is it accessible? Is it understanding? Was it the right information? Did you know where you go? And all of those different types of things is our commitment and our drive. Because I suppose we've talked about this a bit as well, is if we said we're there 100% with all of this, then we would know that's not a fact. But it's very much a tool for improvement. So it's a framework for us to keep working towards, isn't it, Judith?
Yeah.
Would you say the group agree with that as well?
Oh, definitely. And, from a patient perspective, the patient can understand what to expect in a clear and simple language as well. Yeah. So it's very much focused at the patient so that it reduces their anxieties.
And how do you envisage that clinical teams will use the Patient Charter?
So one of the things, we've got a task and finish group for the Patient Charter, and that task and finish group consists of some of our lay representatives and a broad range of staff from across the Trust. And I think key to this is really, how do we integrate it into our business as usual? And one of the areas that we're focusing on at the moment is our quality panels. Yes. So we thought that the quality panel is a really good opportunity for teams that are going through that process to look at their service and to benchmark themselves against the Charter to say, where are we at? Are there any gaps and where could we improve? So the group have helped us. One of the things Joanne Sunderland asked us to do for that piece of work was to think about a self-assessment tool that teams could use, just services could use. So again, the lay reps have been really helpful in helping us. So we just looked at it at our last meeting, didn't we?
Yes.
The tool includes the I statements from the CQC, which are then matched against the principles from the Charter, and then a team or a service can assess themselves about where are we, what can we do as a team to be able to get nearer to those principles and be true to those principles, and actually what can the organisation do, because sometimes as a team or a service there may be organisational things that we need to change to help us improve, and we thought it was really important to acknowledge that. We're looking at things like induction, our interviews, all of those different things. So I'd say we're on a bit of a journey at the moment in terms of looking at how do we integrate it. And the other bit that we're looking, sits with me really, is around our measurement.
Yeah.
So how do we measure patient experience aligned with the principles of that Charter? And we're about to do a pilot of a survey across our outpatients department where we've really used the principles to inform the questions, and all of that will go back to our lay reps, and we'll look at that together to say, actually, where are we at with the Charter when we look at what happens for patients? And we feel quite excited about that, don't we?
We do. I mean, we really want the Charter to be at the heart of, right across the Trust.
And I think that I obviously had sight on the Charter from a bit earlier on than a lot of people, and I took it to our team within the acute medicine, and it made real sense to our nurses and to our staff. And the one thing, I'm running an inpatient service, but the one thing they picked up on was sort of tell your story once and not having to repeat this there. Because we're actually very bad at that, aren't we? Asking people questions, or we're currently asking them the same questions. So there'll be bits that I'm sure every team will pick up and will be more relevant to them. Yeah, absolutely. Yeah, I think there'll probably be lots of energy towards it once you get going. So
Yeah, I hope so.
So we know that you're going to do a launch shortly, is that correct? Yeah, you'll probably be filming more videos, I imagine, for it. So I think we're hoping to put a link at the end of this podcast to people, but just for people to keep their eyes open and look out for it, and really is coming in the direction soon. So, yeah. So I'm sure it will be displayed internally and externally for people to look at, and I think this is a really positive step going forward towards patients.
Brilliant. Yeah. Can I just say, in the meantime, Charlotte, if anyone would like a copy in the meantime, is just drop me an email or the staff experience inbox, drop us an email, and we can send a copy as it stands at the moment for people, because I should say, when we're talking about it, every opportunity, and staff are really interested in who have been in those meetings or the forums and have asked for a copy and say, Jo, this is great. So please don't be held back waiting for the comms bit. Just give us a shout, and we're more than happy to send a copy at this stage.
Great. And I'm really excited because I think it really links back to the lifelong care strategy, and it links back to personalised care, good communication, conversations that involve the patient. And I think this is just consolidating some of those steps. Yeah, great. So thank you very much for talking to me today, and we look forward to seeing the next steps with the Patient Charter.